is never normal to have a symptom, ever. Because before you had the symptom, that's what we called normal for you, always, all right? And like I said, it's like when you're driving your car. It's like a warning light coming up, so your body's saying, hey, something's wrong. We gotta do something, right? Okay, so what do we usually do?
Take a Tylenol.
There you go. Because it fixes everything, right? Tylenol PM for the sleep, right? So here's the thing: if you had your warning light on your car go on, I mean, would you just like take a medicine, or if it was your car, would you just put a little tape over it and pretend it wasn't there? No, you would drive it to the service station and figure out why it's happening, right? Why is that oil light on? Why is that brake light on? Let's fix it, right? You would fix the problem. But we as a nation are in a system where all we do is mask the symptoms. So we just put a little bit of, it's like kind of like the smoke alarms going off in the hotel or in your house. And what you do is you cover up the smoke alarm, but the house is on fire. That's ridiculous. You would never do that, right? You would figure out what's going on. That's why we do this survey, because this is going to explain why we were having pain and how these symptoms are all related. So what can you do to eliminate pain? So Penny Cowan, American Chronic Pain Association, say that people who have active role in their treatment have a better quality of life and less suffering. That means you're proactive. That means that you get busy taking care of your stuff. That means that when you go to the doctor, you don't let them just give you what you have. You interact and you start to talk about it and you start to figure out solutions to the correction, not just like a pill, okay? There's things that you could do, and you try to find alternatives. When you actually get involved in reducing your pain, you'll reduce your pain by knowing strategies that are available. So I'm going to go through some strategies that you can do on your own that will help you, all right? So here's the 5 strategies that are available. There's medicine, surgery, nutrition, exercises, and then there's acupuncture, all right? And I'm going to talk a little bit more about why that's important. Let's look at medication as a solution. All right. So lots of prescription and non-prescription drugs. I mean, we take, on the average, 340 billion prescriptions a year. That's about 10 prescriptions per day per every adult, every American in the United States. That means every infant. I'm talking a newborn. This takes, when we average out how many prescriptions a person takes a day, it's about 10. That's a lot. And that's not counting the stuff over the counter. That's frightening. It's really frightening. All right. 2 problems with medications. They never deal with the cause. So there's never a permanent solution. There's side effects that can actually be worse than the problems. So often even drugs were thought as safe. They've been found to cause heart attacks or strokes after years on the market. This is what happened with Vioxx and Celebrex. That's because they do a great marketing job, okay? And other non-steroidal anti-inflammatories. So even aspirin, although they tell you to, you know, take a little aspirin for your heart, it's going to make your blood thinner. Well, you know, if you like to hemorrhage your stomach, I think that's okay, right? But there's other ways to make that blood thinner. Non-steroidal anti-inflammatories, they relieve pain and inflammation, but they cause, here's the list: gastrointestinal hemorrhages, hepatitis, abdominal pain, and diarrhea. Celebrex has caused acute pancreatitis and can be fatal. Also causes infertility, which you don't hear about, but increased clotting of the blood. Who wants to be clotted blood? You're going to stroke out. And increased risk of heart attacks, all right? This is not, I mean, they gave it to us because they said that it doesn't hemorrhage your stomach, but the actual fact is that the Celebrex actually does. So it's not really any better than taking your Advil, really. Okay, so got to take matters in your own hands.